Let me pull up my.
Okay, we are live.
So good morning, everyone, and welcome on this frosty day to our next meeting of the Hanover Owen Sound Task Force. It's October 30th. I'm going to call this meeting to order. Is there any declaration of interest from anyone?
Happy Halloween.
That's right, this Halloween and my son's birthday.
Oh, it's my daughter's birthday.
Is that right? Yeah, we had him convinced for years that Halloween was all about him and that the community puts on a big event each year just for his birthday. Yeah.
You're a better salesman than me.
It worked for a long while. So item number 3, business arising from the work to date. And we do have that recommendations and opportunities document. Madam CAO, I'm gathering that you're going to walk us through that.
Actually, Randy's going to.
Randy, okay.
Yeah, good morning, everyone.
Good morning, Randy.
Good morning. So staff have started to prepare a document which tries to capture some of the recommendations and opportunities that have arisen from the previous task force meetings. And what we want to try to do is try to track the discussion as we go in order to assist with the creation of the final report, which will be the end result of the work from this task force. So we thought it would be good to include this document as part of each agenda, just in order to review the previous items from the previous meetings, just to make sure that we've captured this correctly, see if there's anything that we've missed. This way, we're not starting the report from scratch, but rather we're building on some of the content as we go. As part of the previous discussions, the task force made requests for further data and information as well, based on some questions that were asked. So we've done some further data analysis to try to answer some of those questions. And we can provide this again as part of the business arising at the beginning of each of the meetings, just again to keep everything fresh in everyone's minds, as well as to address things as we go. So just provide a quick overview of the recommendations and opportunities document. So the first page captures essentially the task force guiding terms as previously discussed, and that's to assess the available social and economic data for Hanover and Owen Sound, including trend analysis and forecasting, and of course to develop that final report, including recommendations and a work plan for council's consideration to address opportunities as well as areas of concern for the benefit of both municipalities as well as the county as a whole. Some of the themes that have been identified are housing availability, employment, transportation, labor force attraction, policing, social issues, which we'll hear about more today, including mental health, addictions, and poverty. So these are some of the themes that the task force has identified that they want to have some further discussions about. So the first meeting, of course, was on the housing theme, and that was the meeting that was held on September 18th. As part of that discussion, some of the recommendations and opportunities that were identified, including the discussion around the homelessness response table as stop for all housing inquiries, and that's that pilot study that's beginning in Owen Sound that's offered by Grey County. You know, is this model scalable? Could this be offered countywide? Were some of the discussions. Would there be merit in having 2 locations for service inquiries, both at Owen Sound and Hanover, for example? What about other communities that extend beyond those 2 communities? How are they currently being serviced? And are there collaboration opportunities, including with Bruce County? Another item was around rent geared to income, and there was questions or discussion around could this program be expanded? Is it a more practical solution than having people move to social housing? How much demand are we meeting? Connecting with tenant services and understanding the main needs of tenants, and seeking perspectives from folks that we have here today, as well as CMHC, public health, food banks, and do we need more supports or service types? The next area was around land mapping opportunities. And this is that looking at what we currently own, both the county and local municipalities and province, in terms of vacant land that could be utilized for affordable housing builds. And then looking at some of the relationships with where those lands are situated in proximity to public transportation, healthcare facilities, grocery stores, recognizing that these lands may be developed for affordable housing and that the residents that would inhabit these units would likely fall into the low income threshold, and therefore having close proximity to services and facilities will be very important. Is there also an opportunity to connect with public health? There was also the notion to explore the rent safe initiative data, and you'll hear more about that as part of the presentations today. There was also some discussion around housing refurbishing grants and understanding that the housing stock in Owen Sound and Hanover is one of the oldest throughout the county. And even given the stat, we could easily make this type of program scalable to be available county-wide. So there it was one of the suggestions. So looking at whether or not there's opportunities, whether it be through the climate change initiative or some other incentives that we can look at to assist with refurbishing some of the older housing stock to make it a more safe and efficient household. Another area, of course, is the community improvement plan, which we've talked about at great length, and how we can expand this, promote this more, work with municipalities and developers in order to really make some headway with respect to the CIPs. As we talked about, most municipalities are in the process of adopting those CIPs or have adopted, which is fantastic. So the next steps are to really start promoting and engaging developers to provide those opportunities that are being offered through the CIP program. There was also, what we're trying to capture is further research requested. So these are based on some questions or comments that come out of the discussions that we need to do some further maybe research and data analysis on. And we've done some of that. So I won't go through this in individual detail, but we'll capture that as I go through the slide deck that was just sent out to you this morning. I apologize, we were working on that last night, finalizing it. But we got it out this morning in advance of the meeting, and I'll go through some of those slides just to explain what we're seeing. The next meeting was in Hanover. That was held on October 2nd. Again, we've tried to capture some of the discussion and recommendations and opportunities that came from that discussion. One was very much, I think, front and center was the lack of developable lands. And so that's working with then local municipal staff through the process to designate additional settlement area lands. We've noted here that the county is going through that growth management study update, which will update our growth projection numbers over the next 25 years versus 20 years. And then working with local municipal staff and the consultant to have a sense of what is happening on the ground from a growth and development perspective. And we're having those discussions as we speak. We're also doing some research as directed by council on what options or opportunities exist with respect to settlement areas that are adjacent to municipalities, and looking for future opportunities for those settlement areas to grow and develop and flourish. So we're doing some further research in that area, and we'll be bringing back a report to council on that in the very near future. Another potential topic of discussion at the last meeting was an economic hub. Eliminating non-residential fees for those coming from outside of the area was a discussion item as a potential area. Attainable housing, of course, was also identified, which we've talked about. Policing and the housing condition, and there was building code compliance issues that were raised. You know, are there targeted educational campaigns that can be done to assist with information, knowledge about what is acceptable or safe versus not? Are there incentives, again, in this community improvement plan program for upgrades for these housing units? And then there was the question about how population density compares to other municipalities. So that's just a quick overview. What we really want to capture today is the notion that we want to bring this document forward. It's a living document. We want to bring this forward at each meeting just to kind of capture again the discussion as we go. If there's anything we've missed, we can obviously address that during the task force meetings, as well as if you have any questions or comments, feel free to contact us. and we can add to this document as we go. So I'll just open up there before I go into the slide deck in terms of if there's any questions or if there's anything that you've seen that we missed as part of the discussions previously.
Thank you, Randy. That was very good. When I saw this document, I was very pleased to see it because it nicely encapsulates some of the discussion that we've been having. And I noted at the end, we have to produce recommendations and a work plan. So this fits nicely into that, because at the end of the day, what is it that we want to do? And it's easy for us to forget, and minutes don't quite capture everything. So this is really great. I thought it was very helpful. Other councillors or committee members, I should say, any comments? I see none, Randy. Then maybe you're going to start with your slide deck.
Perfect. Excellent. Thanks. Can everyone see the slide deck on the screen now? Yeah.
I can.
So this again is a follow-up to some of the information or the questions that were raised as part of the previous discussion. So we've tried to capture some of that data information. Again, we'll highlight this as we go, just as an update to keep it fresh in everyone's minds. So one of the questions that was raised is, how does Hanover's population density compare to other settlement areas in Grey County? So as you can see in the slide here, we have Hanover and Owen Sound as being the highest in terms of population density. So these are persons per square kilometer. And these are our fully serviced settlement areas in Grey County that you see on the slide. So as I mentioned, Hanover and Sound have the highest population density with just over 1,000 people per square kilometer based on the 2016 census data. The next closest is Dundalk with just under 1,000 people per square kilometer. Followed by Meaford, Durham, Thornbury, Markdale, and Neustadt, as you can see. So again, this is some of the information and some of the questions and information that was came from the discussions, and we wanted to provide some of this data for the discussions. The next one is employment income. So this is the number of people with employment income by municipality and the number of people without employment income. So this includes residents over the age of 15. So this would also capture residents who are retired. So Owen Sound, as you can see, has the highest number of people with both employment income, which is over 11,000 people, as well as the highest number of people without employment income being just over 6,000 people, or about 30% of their population. West Grey is the next highest with just over 7,000 people with employment income, and just over 3,000 without employment income, or about 25% of their residents. And then Hanover has just over 4,000 people with employment income and just over 2,000 without employment income, which is about 26% of their residents. So that was some of the discussion and questions around employment income and how, who has employment income, who doesn't, and comparing the different municipalities. So that's some of the information that we were able to capture for that. The next one is household income under $30,000 by municipality. So this is we think a very interesting slide, and Owen Sound has approximately 2,500 households that have a total household income of $30,000 or less, which is about a third of the households earning less than $30,000 in the entire county. Meaford is the next highest with just over 850 households, and Hanover is the third highest with just over 750 households, which is about 10% of all the households in Grey County, again, that have a household income of less than $30,000. And that $30,000 was used as kind of that threshold that was identified through the discussions about the residents and the households that may be in that core housing need category, the ones that are living in certain conditions where they're probably struggling day to day just to try to pay the bills and to make a go of it. And so this is where we've identified the numbers of households that are within that category.
So Randy, sorry to interrupt you, but we're going to hear from Jill in a bit. But is that 30,000 marker not a sign of poverty, but it's a sign with respect to affordable housing?
Yes, yeah. So it's one where we've identified that from a housing perspective, where we think for sure that they would be in need of what we would consider affordable housing. And then there's the missing middle housing, which we've categorized between that 40,000 to 100,000 category, where they're probably in need of also some more affordable housing, but more attainable housing, what we're calling it, right? So this category we think is capturing the residents in our area that are in need of we think are that more affordable housing category, or rent geared to income category, or other categories in terms of, you know, just being able to pay for housing as well as other bills that in order to be able to survive, essentially.
So Randy, I think it'd be interesting to see, and Jill will probably help us with that, to see how that number changes from 30K to say whatever that number is for poverty line, and to see what the impact is in terms of Hanover, Owen Sound, and the other municipalities throughout Grey County.
Absolutely.
Mr. Chair?
I can hear someone, but I can't tell who it is. Go ahead.
Kim.
It's
Oh,
Kim.
Okay.
And part of that is if you're working 35 hours a week and making
Kim, we're having trouble hearing you. Sorry.
Can you hear me now?
Perfectly. Yeah.
Okay. If you're making $15 an hour and working 35 hours a week, you're coming in just under 30,000 as your income.
Okay.
So that was part of it too, to say if you've got essentially a full-time job, but you're making minimum wage or just above minimum wage, that's kind of where your income's going to fall.
Thank you.
Mr. Chair, I do see that Councillor Desai has a question.
Councillor Desai, go right ahead. I can't see you folks, so you'll just have to speak up.
Okay.
Sounds good. Thank you very much, Mr. Chair. So my question to Randy, I guess, is if we're saying that you need to make around $30,000 to have to be able to afford housing in Grey Bruce at its lowest level, are we saying that the minimum cost for housing in Grey Bruce is at about $10,000 annually? And if Randy could also expand a little on what the definition of the household is in this sense. Is this, for example, if there's two people working a minimum wage job in one household? So if you could expand on the definition of household.
Yeah, we'd have to dig into that a little bit further. You know, I'd have to go back and look at some of the previous data and slides. I don't have those in front of me at the moment, but we can definitely look into some of those questions further and bring that information back for sure.
If
Jill
I could just jump in, Randy, for a second,
Yeah.
just to let you know, the census data does break it down, whether you're a lone parent or whether you're female, because we also know that females get less income than male-headed households. So there's a lot of variables. We also know that people, invisible minorities, also get paid slightly less than others. So it's not just a simple case of assuming the median household income of the average person and household would be double. You know, perhaps they're making that 50,000 a year, but there's so many other variables that Randy could look into. And I know that both the demographic details that the health unit put out break it down further.
Yeah, and I think we broke that out into previous slides and data that we've collected before in the past, so we can highlight those for the task force members again in terms of some of those breakdowns that Jill just described in terms of you know, single residents per household, female males in those households. Yeah, so Brad's done some of that analysis and we've broken that down by each municipality. So we can provide that information further, especially in the final report for sure.
Yes, and Randy, if you don't mind, Jill did put in her comments there, she put a note that says affordable rent equals 700. Is that 700 per person? So if there was a husband and wife, would it then be 1,400?
Possibly, yes. What it's looking at is 30% of their income, which is the
All right.
ideal amount that you would pay towards your housing costs.
Thank you.
So that's just an estimate for somebody, a single person on minimum wage.
Okay, so thank you for that, because we have heard the 30% figure at previous meetings. I just didn't know if it was 30% of one person's income or the entire household income. And I'm hearing it's the entire household income.
Yeah, so that's just calculated for one person if they were the only person earning. It would expand as per the number of people earning in a household.
Understood.
Yeah.
Thank you.
May
And
I
which we
have
know
something?
from previous stats and data that there's a lot of single person households, especially as Jill indicated, the single person households in our communities. And therefore that $700 rent per month is that level that they'd be looking to try to come in at. And we know that just based on the supply and the rental market currently, it's usually in excess of $700 a month for rental units.
I heard someone else piping in.
That was
now.
Anne Marie. May I comment?
Absolutely, please.
And I just wanted to point out seniors too. A lot of the people making under $30,000 are our seniors. If they are on just a no pension, just strict CPP OAS, and they would be included under this. And also just looking at Owen Sound with those 2,565, we have 500 units of rent geared income in Owen Sound. So we do have a large number of people. All of them would have been making under that $30,000. So certainly there's lots of need out there, but I just wanted to point out our seniors. I know we have a very high percentage of seniors that live in Grey County and would account for a number of under the 30K.
Thank you, Anne Marie. Any other comments before Randy moves on?
If I may, it's Sarah.
Go ahead,
Just to
Sarah.
add to the discussion, thank you. Just to add to the discussion, the work that the United Way has done around the living wage analysis. So that does take into account the amount of money, so the hourly wage required to ensure that someone is not paying more than that 30% of their income for the essentials of life, right? So housing, food, their utilities, those kinds of things. And so that's some work that the United Way has done as well.
Thank you.
Excellent. So just
Randy, back to you.
Okay, thank you, Mr. Chair. So moving on to the next slide, this is digging into some of the Ontario Works data and information that we thought would be very good information to share with the task force. So this shows the Ontario Works caseload by municipality. And as you can see, Owen Sound has 659 people receiving Ontario Works, which is just under 40% of the people overall that are on Ontario Works residing in Grey County. West Grey and Hanover are the next highest with approximately 150 people on Ontario Works, which is approximately 11% each of the Ontario Work caseload for all of Grey. So the graph on the right shows the percent of population by each municipality. So for Owen Sound on Ontario Works, so for Owen Sound, 3% of the overall population for Owen Sound is currently on Works, and close to 1.8% of Hanover's population is on Ontario Works. So we wanted to share some of this information as well. This breaks it down further, looking at some further data with respect to those in Ontario Works, both in Hanover and Owen Sound. So this first slide shows that. And as you can see, there is a higher proportion of females that are on Ontario Works in Hanover. The average number of months on Ontario Works assistance for Hanover is just over 44 months. And the median, or that middle value of the data set, is just under 25 months. So what this likely shows is that there are probably a few people in Hanover who have been on Ontario Works for quite some time, which skews the average months to be higher. And therefore the median number is probably the more indicative number of how long people would typically need to rely on Ontario Works in Hanover. Another interesting stat is the education level for people on Ontario Works. And in Hanover, over a third have a high school diploma and close to 17% have a post-secondary degree, meaning that over 50% of the people on Ontario Works in Hanover have at least a high school diploma or higher. So this shows that some people are experiencing challenges beyond education-related challenges in order to be able to enter back into the workforce, whether that's, and we'll probably hear more of that today from Jill and Sarah, and whether or not that is mental health related challenges, challenges with respect to childcare, especially for single parents, or some other related challenges. And like I said, I'm sure we'll hear more about some of those challenges from the presentations today. This slide here is similar to the last slide, but it's specifically for Owen Sound. And similar to Hanover, there are more females on Ontario Works in Owen Sound than males. The average number of months per people on assistance in Owen Sound is 38 months, with the median just being under 24 months. And that's similar to the numbers in Owen Sound as well. And also similar to Owen Sound, over 50% of the people on Ontario Works in Owen Sound have at least a high school diploma or higher, with over 16% having a post-secondary education. So again, we find that just very interesting in terms of, and some of that information just helps to tell a bit of the story, I guess, in terms of where maybe some people are experiencing some of those challenges. And like I said, we'll hear more from Jill and Sarah on that today. The next slides. So one of the questions that was asked at the housing theme meeting was, who owns the apartment buildings within our various communities? Are they local owners? Are they owned by a number of folks, that own the bulk share, say, of the apartment buildings? So what we did is we've dug into some of the MPAC data and information. So this slide shows the number of apartment buildings in Owen Sound using that data. And there are 219 apartment buildings in Owen Sound. And these include buildings with 3 or more rental apartments, right up to the multi-residential building category, which is 7 or more units. So these could include some of our larger apartment buildings as well. The average year the apartments were built is 1903, the being 1900. So this goes back to that our housing stock is older, and you'll hear more from I think Jill's presentation on this as well. 90 of the apartment buildings are triplexes in Owen Sound. 52 are multi-residential buildings. Those are those 7 units or more. And 48 are residential buildings with 4 apartment units. Although we've removed the actual owners' names from the slides for privacy reasons, we do have this information. And therefore, we know who owns the majority of the rental apartment stock in each municipality. And we can also break this down further on the types of apartment buildings that those folks own. So for Owen Sound, there is one property owner who owns a total of 33 apartment buildings, or 15% of the apartment buildings in Owen Sound. Grey County owns five of the apartment buildings in Owen Sound. So the next slide is Hanover's breakdown in terms of the apartment buildings. So there's a total of 77 apartment buildings in Hanover. The average year built is 1948, and the median is 1920. So a little bit newer than Owen Sounds, but still fairly old when you're looking at, we're currently in 2020. So we're looking at 80 years old plus, right, in terms of the average years built.
We're a modern community.
Yeah, exactly. The majority of the apartments are 4-unit apartment buildings. As you can see, there are 29 apartment units that are 4 units buildings, and there are 21 multi-residential buildings that 7 or more unit category, and 15 triplexes. One owner in Owen Sound owns 12 apartment buildings. So again, just over 15% of the apartment buildings is owned by one owner. Grey County owns 3 apartment buildings in Hanover. So part of the next steps, which was part of the recommendations and opportunities that came out of the Hanover Owen Sound Task Force meeting, was to have some further discussions with some of these apartment building owners to understand some of their challenges and opportunities to not only maintain their existing rental stock, but to potentially expand their rental housing stock. And this is something that we can report back on as part of the final report. So that's part of the next steps that we're going to utilize some of this data and information for. So So that concludes kind of the data analysis overview and of just to provide some further information about, from the discussions that we've had with the task force previously. We're happy to take any further questions or comments.
I would just say, Randy, as we drill down, the illumination becomes fascinating. It really does. When you see this data, I'm already impressed with this task force just for knowing the information, gathering the data that we have to date. Other committee members, any comments?
I do see CAO has her hand up, and I will just note that Councillor Millen has joined us via phone.
Okay. Thank you. Madam CAO.
Oh, thanks. Just one question. One of the early slides talked about the density, and Randy, the official plan provides the density that we're seeking. Can you remind me?
Yeah.
Where we are?
For Hanover and Owen Sound, for all new developments going forward, our recommendation is a minimum of 25 units per net hectare. So when we're talking about net hectare, we're netting out things like roads, stormwater management ponds, environment, hazard lands. So that's the actual developable area essentially, and we're trying to achieve at least a 25 unit minimum.
And then you're using what, 2.2 persons per?
Yeah, it varies by community. It's anywhere between 2.2 and 2.8 in some cases for each community, but yeah, it's roughly in that ballpark.
Okay.
So
I just want to thinking about the the business case or the advantages of looking at that, and you take that density number and you also look at servicing capacity and what servicing capacity Owen Sound and Hanover have already invested in, and what potential there is for infill and that sort of thing. But
absolutely.
Okay.
Yeah, and we also have infill targets that we've identified in our vision as well. And then for other settlement areas outside of Hanover and Sound, it's 20 units per net hectare. So those are like Dundalks, Meafords, Durham, etc. So it recognizes that Hanover and Sound, because we're Hanover and Sound have the key services and facilities. We want to make sure we're maximizing density in those two communities and the infrastructure as well. So
thanks.
I think there's could be something there further, Kim, that we can aspect in terms of promoting higher density in communities in our primary settlement areas for sure.
Okay.
Randy, on the density matter, I have the sense that we are not doing that well on the density piece, because it appears, at least anecdotally, this is what I'm seeing, it's more attractive for the builders to build those, single grand homes. There's more profit in that, it seems, right?
There is, but historically, what we were seeing is definitely there was a lot more single detached homes that were being built. But in the last few years, some of the data slides I think that we presented previously, it's showing that there's a trend that's switching. And partly is that's based on policy, but also a market demand, as well as people just not being able to afford those larger, or in some cases even smaller single attached homes. They're looking for a different product, and developers are responding, both from a policy perspective as well as from an overall just market perspective. So we are seeing definitely a switch to a more higher density and multi-residential product. And even the last 3 years, I would say, we're definitely seeing a switch in the right direction, so to speak, in terms of seeing more higher density and different products, more than just single detached like we had historically. We're getting 70s townhouses as well as other multi-residential buildings as well.
Yes. I have to tell you, even townhomes, I'm looking just at Hanover, and Hanover is certainly not the town of the Blue Mountains, but even in Hanover, a townhouse is unbelievable. The price, and part of what I'm hearing is because the scarcity of land, that price goes up.
Yeah,
it's not cheap. Okay.
Mr. Chair, I do see Warden McQueen has his hand up.
Oh,
Thanks, Mr. Chair. And I just thought it was interesting that the average year built, is I find that quite surprising. 1903 and 1948 in Hanover, and so I would take that a lot of those buildings have been retrofitted or continued to be retrofitted as time goes on, and I guess it's always encouraging that if that seems to be the norm, are we providing or is there linkages to grants and upgrades for those or future opportunities for buildings to be upgraded to apartments? Because if that's sort of they're repurposing older buildings and making them, and I would presume that probably some of those, maybe more specifically in Owen Sound, could be even storefront tops or whatever, right? Downtown units and stuff like that. And because I know there was a comment about some of our small towns just in Grey County where for housing, and the thought was, well, they're old buildings and stuff, but obviously this proves that a lot of the apartments are older buildings, right? And so we just have to embrace that. And so to bring that average up, or that average year up, it looks like there's got to be a lot of new housing to at least bring that medium up, right? And I wonder what that's like across the provinces. I guess that's sort of quite common, maybe in small towns or small urban centers. I don't know. I just find that quite interesting that that is the case. And but I guess that is good for repurposing. It does cost a lot to tear down a building and build a new one. And I don't know if Anna Marie has any more to add to that, but it seems like that's what we have. We're embracing that, and we just have to understand that is the norm, and we'll move on, I guess. And anyway, just interesting.
yeah, and I guess Warden, for me, it also gets to the point of if that's where the affordable units are, then it also speaks to quality and dignity.
Yeah.
Because what we are doing is we're really pushing people who are in need into substandard and oftentimes with building code deficiencies. And that's sort of what we say. We allocate them to those units and say, that's what you get. And, that just isn't right.
But it's probably going to take some time to increase that age. It's something that's like, it's a big elephant. It takes time to turn it over, right? So it's going to take time. And probably those older buildings are under a different standard than they are today. And that's probably, like you're saying, in the sense that, but I would hope that there's, working with those, or if there's opportunities for those landlords to have the opportunity to upgrade those buildings, so then they do have the ability to increase that standard and quality of life as well. And there's also, I'm sure, maybe Anne Marie could speak to this, or even from the building code, there's probably upgrades that have to be done. I guess when you do a major renovation or through a building code, you have to bring it up to a today's standard and that sort of thing. So I guess is there, I guess through the Landlord and Tenant Act, is there measures in place that does check? Like, I know we talked about that in Hanover there a month ago when we had this that meeting where that was that one apartment that wasn't meeting the standards with smoke alarms and all that type of thing. Is there, how do we have those checks and balance that, even like you said, Mr. Chair, that quality is being maintained of that? And is there, like, is it by complaint based through our building code or through other fire departments or whatever? How do we maintain that quality is being, is there?
Randy, we talked about the Rent Safe project that was done from Queens. Is that gonna be presented here, or does Jill have some of that? I think that project that Queens did with the health unit, I think, is very, very telling as far as what all of the issues are that come with such an older housing stock, and the people that are having to make the choice to be tenants in those apartments who don't always have a lot of choice. They take what's available to them. And in small towns where that group of people that are landlords are small, it can be a real problem for people to really, make requests or make complaints and ask for changes. They know that there's a long line of people standing behind them that would also like to have access to those apartments. They don't have a lot of ability. So it's tough, I think. But
Yeah,
were we going to bring that to this table?
I think Jill's going to be
Safe?
speaking
Oh,
to that.
Spooker. Okay.
Yeah.
Thank you.
I'm sorry to jump in. Do you want me to answer a few questions in response to Warden McQueen?
Yes, we're probably jumping in on your.
Yes.
It's okay, because I don't want to duplicate. And I was just on the Attainable Housing Task Force meeting with Saugeen Shores. And so we just threw the slides away other than the data points and really spoke to the issue. But I think Warden McQueen, I mean, that is really critical part of what we've been looking at with Rent Safe. And even before we formally moved into a Rent Safe project, we did a project with our community voices and our Grey Bruce Public Health Unit around above standard housing, and just getting to what is standard housing and how is it enforced. And it is by complaint system right now in Owen Sound. It is not something where I know that Tim could probably speak a little bit to where they balance it out with the housing standards, but a lot of it is by complaint. So there's the Rent Safe Public Health Unit survey that we did, and there's a report called Above Standard Housing. And that is listening to tenants, but it's also interviewing landlords and looking at both sides. So this is a very balanced approach. It's not just one. There's also a municipal bylaw enforcement and property standards officers survey. So checking in with how challenging it is to be a bylaw officer and the limited number of staffing we have in both Hanover and Owen Sound to be able to do enforcement. So it really is not a proactive system in place right now. It's a reactive system. And I know that Tim knows with the declared hotspots in Owen Sound, it's very complex when you have mental health, substance use, and a combination of things within one building. Randy really importantly presented to you who owns a lot of the rental properties. And that's a critical dynamic in this whole thing as well. So both listening to the landlords, but when we have close to 50%, and what are the exact numbers? I was going to give in my presentation, but close to 50% rental properties, then that's a substantial amount of homes that people are living in. And so there's a lot in, we have probably close to 10 reports that were prepared with Rent Safe. And just to let you know as well, we're continuing. I was just talking to Erica yesterday. And so we've got some potential with the University of Montreal to continue for the next year or two, more research and study here in Owen Sound. So that gives us access to a lot more intersectorial coming together on inadequate housing is what we call it.
I think it's quite fascinating how quickly a meeting on Hanover Owen Sound Task Force can turn into the housing.
And yes, you've been on the call for our housing and homelessness task force, or our action group that meets weekly. We're dealing with this weekly. And right now under COVID-19, actually, it has intensified because we've had to keep people housed. One of the biggest challenge, and this is in my presentation, it doesn't really matter, is the inability to move people from place to place because of the low vacancy rates. So people have to put up with what they get. And if you only have some very large landlords, and you don't want to piss off that landlord because you will not find another place to live. It's extremely difficult. And so we do have with our homelessness population is a lot of people that are chronically homeless because of a complex issues, whether it be mental health or substance use. But we also have families that have burned their bridges with certain landlords and then find it a struggle to find housing.
Of course.
So there's multiple stories around that. So the interviews we did started with our community voices at the Poverty Task Force, and they record those stories. They also talk about the systemic racism against the Indigenous population and trying to find housing as well for those people that are living off reserve. And we've seen a larger influx of people coming off Cape and Saugeen when the borders were closed. We saw a lot of people under COVID-19 recently that have had to leave because of conflict in the family. You know, you're couch surfing, and then you can only couch surf for so long, and family tensions come up, and we've seen things with domestic violence as well.
Right. So, Randy, it looks like we have transitioned quite nicely into Jill's presentation. Before we fully transition, I would just maybe allow committee members to have an opportunity to comment on what we've heard so far, and make the point that, you know, with the scarcity of number and scarcity of providers, it appears to me that maybe in their interest to not do upgrades. Why? Because the demand is so high, I don't have to. You know, if you don't want it, well, somebody else is going to come along and take it, and I know that. So where does that leave us? Anyways, if there aren't other comments from committee members, I'm going to turn it over to Jill, and you can re-present or maybe re-summarize and do your proper presentation that you had prepared. Committee members? Seeing none, then Jill, you have the floor.
Okay. So just 1 second while I get.
And for those following along, this slide deck was attached to, well, I found it as part of the agenda online.
Yeah.
So you could
And
follow.
I apologize in advance. I'm giving a presentation just related to poverty, but unfortunately housing seems to always dominate. So it will appear like I'm giving a housing presentation. A lot of what I'm going to do is quickly go through some slides because you've received that information already. So just a couple of slides for your references. Most of you around the table already know us. We are a multi-sector a sectoral agency, if you will, organization, complex network, lots of people around the table. What I would say in observation is that one of the things we don't have around our table right now is the business sector in a larger, meaningful way. And this was pointed out to me recently by somebody coming from the business sector saying, where are we in all of this? Mm-hmm. And it's interesting that we do engage with them at various levels when we talk about housing and engage with landlords. When we talk to the Chamber of Commerce about the living wage and minimum wage and precarious work. But we don't have them reflected here in a meaningful way. So that is just something in terms of our membership. We have been pushing lately to go for a collective impact. And so that's really trying to bring as many of our partners together to look at a common agenda, to look at some shared measurement, and to look at what are mutually reinforcing activities and continuing to work with that. It's been really easy in the past for us just to list the activities we do. So you will know, how many people are being fed by the keeping not-for-profits connected during COVID-19. 65,449 meals provided in just 4 community food programs. You'll know the number of people housed. And so we've got a lot of joint activities, a lot of dollars going out for emergency Band-Aid work right now. But what we're trying to do is take it up to the next level and trying to change things to have a more significant impact. Our areas still connect with food, income, housing, and then a really critical one was ensuring diversity, inclusion and engagement in municipal decision making. So one of the critical aspects that we have found is that a lot of our community voices are involved with our projects, but they're not involved in decision-making levels, whether in the local municipal councils, we don't have formal representation there, or really getting involved in some of the policy system change. So that's a critical aspect that we encourage. When we look at poverty, we are looking at it from a perspective of a person, an individual, the institutional, and community. And it is the amount somebody is in poverty, not just because of their income levels. So 32,000 is sort of that living below the poverty line. And my slides are jumping on me. But we're also looking at all the other resources. So if they don't have the housing, if they don't have the food security, if they don't have transportation, all the things that you've already touched upon, if they live in an area where they've got affordable housing, but they don't have the services they need. And that drives a lot of the movement around Gray and Bruce, is people looking for services and accessing them, as well as trying to find the affordable housing. This slide really just gives you an overview, and many of you have been in a poverty task force presentation before or heard about our Bridges Out of Poverty. It really looks at how we go through all of that. So working across the sectors to address the root causes and support individuals to build resources, but also looking at what the community offers in terms of resources. So it was really interesting to look at the numbers on OW and see how many people actually do have their education, but are still experiencing challenges with income and affordability for life. We pulled together some key sectors. So looking at Bridges Out of Poverty, we looked at some key data for Gray Bruce, food security, health equity, income, and then housing. And I chose today, not knowing how much you had already done on the housing, to really look at that as a key factor. So our main integrated looking at all of this data. I do have the breakouts for Hanover and Owen Sound that I can share the data. But Randy's done a really good job at tackling that. What I do want to emphasize is the fact that we can't just look at one single aspect. We need to look at all of the aspects around an insecure livelihood, an insecure housing, having inequitable access to health care, and then of course not having enough food and providing the nutrition for a family for them to thrive is really critically important. We did a community well-being survey. It was collectively done across, and we really came up with a difference in those that have higher levels of well-being and those that are below average. And the profile for that is those who are below average well-being tend to be women. They tend to be younger, living on their own or as part of a couple with children at home. They're working multiple jobs. They have less job security. They usually have some sort of a chronic illness or disability, and they're more likely to spend more than 30% of their income on housing. So those are the population that we largely work with. The reason why I selected the housing slides is partially because it's where we have concentrated a lot of our work. Housing is foundational to all aspects of well-being. And that's the core of our rent safe research, is that without a decent place to call home, you really don't allow people or encourage people to progress, to be successful, and to be able to provide that foundation for their children to be successful in the community. So being able to live where you work, so that goes back to that population, the density, and having the available services in that area. It's why a larger number of people come to Owen Sound instead of living in the smaller towns, is because they might not have the transportation to access the services they need. If you can't live close by your work, then of course affordable transportation is critical, and I know the council's already addressing that with the GTR. We have with our Bridges Out of Poverty some programs, and I know many of you have been there, and thank you for your support for the Getting Ahead. So I'm just going to read a couple of things that they prioritize. So these are people that are on OW or ODSP, people living fairly precariously in both Hanover and Owen Sound. And so the Hanover assessments from 2015 to 2018 have prioritized public transportation, affordable housing, a place to shelter as well, because there are certain units that can afford shelter, but a lot of it right now is people are staying in the motels. Economic investment, that job opportunities beyond retail work, more full-time work, food security, the school nutrition programs they feel are underfunded and not supporting them in the schools, and also the varying prices of the same food in different geographic locations. So where you live, you might live near the more expensive grocery store. Most people would like to live where the cheaper ones are. Without a car or public transportation in Hanover, you sort of choose which side of town, either in the downtown core or further out to it's a food basics, right? So that affordability in your groceries, a lot of people end up spending a lot more money on corner stores than actually getting over, because it means crossing town and carrying groceries back. In Hanover, they also ranked access to a medical doctor, a family doctor, was challenging. And so there's a long wait list for them to obtain a family doctor. So you may see them going to Emerge more often. And there's a lot of data on how much people go to Emerge. I don't have the specific data for Hanover, but it was something they prioritized. In Owen Sound, you won't be surprised that the demand for emergency housing has gone up. Most of our Getting Ahead members are all concerned about finding homes. A lot of our Getting Ahead members joined our Community Voices and have been part of our Rent Safe project. And we've already highlighted the fact that finding a place to stay that is safe and above standard and affordable is challenging. A lot of people move 2 to 3 times in a year. With each move, they don't take everything with them. I know Anne-Marie is already prepared and presented on terms of the wait lists for going into social housing. It's a bit of a catch-22 when we're looking at people accessing services such as addiction services. So this was something new to me. You have to have an address for the next 6 months to enter into detox these days. There is a wait list to get into detox and to get into places like G&B House. So it's a timing issue. And I know we talked to Tim recently about people can be ready at that moment to go into detox, and we just don't have the services to meet that demand on that day. It's a luck of the draw if there's a space opening up for you. So some of the complex issues are not easily solved just by saying go to detox. So it's a bit of a catch-22 when it comes to the housing. With it, food security under COVID-19, we're seeing a significant increase in the need for meals. We're really seeing a lot about the social isolation that's coming out, and people want the hot meal programs to increase, and people want more social connectivity around that. So we've seen a lot of seniors that have been isolated in their homes, and I think that's contributing to a large increase in the number of people we're serving with hot meals right now. And I think the number right now is 65,449 meals served since March. And that's out through OShare, that's through the Young Yum program. So Paul, that's all out through Southeast Grey. Economic opportunities, we have the living wage, which is at $18.32. We have the minimum wage now that is at $14.25. I already shared the sort of the numbers. You're still below the poverty line with that minimum wage. And we all know the cost of living is going up. The other side of that is there's an increase in the need for people to access utility support programs, and a basic income is something that we are advocating for right now. which would see. Under the COVID-19, we saw the CERB being higher than some of the OW and ODSP rates and some of the wages people were making on minimum wage. So it was interesting to see that that was a calculation that was providing people enough to live on. And yet we have, as Randy showed with the OW numbers, we have so many people living on less. We also have in Hanover and Owen Sound the most numbers of payday loan establishments, which if Brian was on the call today, he would also, and I think he is there, would know it's a little bit of my pet peeve is the number of Easy Home and others, 7 different types of cash marts and easy homes that are available that without an alternative loan system, a lot of people need to go to these and pay extremely high interest rates. The government is doing a lot more regulation around the payday loan system, but it is an indicator that people are desperate when we see the increase of those payday loans in our community. So Hanover and Owen Sound are the only 2 that have the physical locations, but we also know everybody can access them online just by a phone. Health equity, as I said, it's a long-term access to mental health services, and that makes a lot of our housing complex, and that hits on our homelessness a lot. People are challenged to access services. There's wait lists. We know the policing is not a solution to that, and the police chief Ambrose in Owen Sound has come out and said that. It's a complex issue around people. It's not going to be solved by just policing and fining people or putting people in jail. Drug coverage is difficult for people on low income right now. There's a certain amount that's covered by if you're on OW and ODSP, but there is that category of people that are not taking financial support or social assistance. They are working 2, 3 part-time jobs. Each one of those part-time jobs does not offer them a drug benefits. We know there's no dental coverage for adults. We do know seniors are starting to get a lot more with the new seniors program. One thing about the addiction services is that they are affordable, but not necessarily accessible for women. We know that there is the local rehab, the closest one is looking at Goderich and further south, but it's a big challenge for a lot of women who have children to make that choice to go into rehab and what happens to their children. So that's a barrier. And it's not just childcare, but it's really custodial protection services, kinship, a range of factors that come into women choosing alternatives to rehab. We also know that our alcohol consumption, obesity, and heart attacks are higher than the Ontario average. So that has a really high impact on people's ability to advocate for themselves or make changes when they're looking at housing or jobs or seeking more health care. I'll go very quickly to rent safe. Obviously, this has been our biggest focus at the Poverty Task Force, has been working with the team at Queen's University on this research, and it's participatory research. So it has included retreats, interviews. There's produced quite a few videos. There's been a lot of discussion about what is above standard housing. What is acceptable, and it's been interesting. Our community voices have accepted a lot lower because there's no place else to go. They speak about blacklists. Once you get on that blacklist, it's hard to get in, find another place. They speak about the challenges of mold and substandard. They talk about trying to partner with public health. If you call public health, you'll get evicted. The same thing happens recently in the discussions, and Tim hosted 2 weeks ago a conversation around why don't people seek better housing? And when there's complex issues around addictions, substance use, mental health, people tend to stay within that community because they don't trust the system sometimes to offer them something better or to be able to hold on to that something better. We've also been working on the Giway project, and I'm going to just move my slides along. So Rent Safe, the Equip project, and the Giway project, both of them are bringing players together they're both people that are tenants. They're people that are landlords. The fire departments are there. The bylaw enforcement is there. Housing, social housing is there. And then a large number of the service providers that are trying to find the places and meet with the landlords and negotiate to keep people in housing. So that's CMHA's Community Connects and et cetera. But I think one of the transformative aspects of all of this project is the listening. But is also the leadership is not hierarchical. Everybody's sitting on an even table and coming to a round table and meeting, particularly with the Giwe, which is an Indigenous-led approach to understanding housing and to understanding homelessness with that population, if you will, and also understanding how do we deal with trauma and understanding that not having a home and growing up without a home is traumatic. And so there's a lot of mental health engagement. There's a lot of people trying to address their trauma through drugs and alcohol and unhealthy approaches. So we have to have a harm reduction approach. We work really closely at the Poverty Task Force with the Community Drug and Alcohol Strategy, Violence Prevention Committee, and all of the housing providers to come together. Two key points out of this is relationships do matter. I mean, it's so critical, and that's the core part of what we do at RentSafe is creating a safe place to share the stories, but also to create that that dynamic that's going to generate those innovative ideas on how we can work better together. We need to tackle the urgent, but as Randy and his team and Anne-Marie and her team do, we also have to plan for that long-term change. Our community voices need to be at the table. We get a really deeper nuance into the realities. I can remember when we had our community voices at the operations table discussing the new transit routes. And some of the logic to why people would ride one bus versus another bus just didn't make sense to me as a middle class person who drives, but made perfect sense to some people who said, well, you avoid those people on the bus at this time because you can get faster to the hospital for an appointment, or you can get faster over to OW. And it was interesting how they were battling against people being employed versus people who were accessing services and weren't employed. So they were going to cut one of the faster bus routes, but people were saying, but I've got to get to that 8:30 meeting at the Grey County building, or I have to get to the hospital to get in early to sit and get through appointments. So it's really important for that. The other aspect, I think, which has been touched upon, which is really, really fundamental, is that the research is proactive. It is looking at proactive solutions. It's trying to come up with ways that people won't feel excluded from the system of agencies and services that tell them what to do, so that we build more warm referrals. The flip side of it is also allows for the staff that work in our agencies that are providing the housing or trying to find the housing. A lot of times they feel trapped because we just don't have enough resources. And it's really frustrating as a service provider to say, you know, here's a list, go call. We're sorry if there isn't anything else. And so we have that challenge as well. So there is a need to foster more meaningful relationships across the housing sector and continue with RentSafe. And we do have more funding coming in, but also a lot of what we're doing with the housing, we're interacting with our health equity, our transportation, the food security. And ultimately, we are looking at people's income, which needs to be more sufficient to be able to afford all of those services and to be able to stay housed. Mawikadon has led us in a new way of working. And I think that I would recommend, as you already have in some of the notes that were pulled together for the opportunities, is to really look into the research that we've done, the participatory research that we've done with RentSafe. And there's also the Giwe evaluations have been done as well on what is working to try and reduce poverty, but also to improve our relations to address things. So just in these slides, there's just some contact information around Rent Safe, but also Giway.
Great. Thank you, Jill. Jill, I wonder if I might, you talked at the beginning of your presentation about the participation, and you talked about a lack of participation from business particularly. And I would tie that into the minimum wage debate. Because you talk about minimum wage at $14.25, and I think you said the living wage is at $18.30.
39.
So there's almost a sense, at least this is my experience from some in the business community, that poverty advocates are to an extent the enemy because they're driving up that that cost I have to pay. I wonder if you might talk for a second, because I know that I know some of the answers, but how does it benefit business or society in general when there is a higher, more sort of living wage, let's say? How does that benefit business and society in general?
Well, I think it's, we know that let's see, it's a catch-22. You can either spend your money on your taxes and providing your services to everybody. There's a story that goes that Walmart has a really great HR department which will support you to get onto social assistance while you're still working at Walmart with your lower wages. And that's something we don't want to see. We know that many of our small businesses, and some of the data that you've shared, are precarious themselves. And so they are not able to always pay that higher wage. And in fact, they're at a risk. And we're seeing a lot of that under COVID-19, where they don't have the profit margins that would allow them to pay the higher wages. What we do know from studies is that when a living wage is paid, it does look at the cost of living, and it makes it compatible for a person to be able to pay for their housing and pay for other services. We also know that from studies from 4-county market labor planning board on precarious work, that you also get more loyalty and trust and less turnover. You may have to pay out more benefits. And again, that's looking at people that are working more than 20 hours. It does then require paying out benefits, but you will have people taking less sick leave. You'll have less turnover. 4-county labor planning market board, their January 2020 precarious work survey looked at why people were leaving jobs and why was there high turnover. And a lot of it was, they said, the low pay, the there was a sense that they didn't have a relationship with the employer, how do you say, described it as, the relationship with the employer was, I don't owe them anything because they're paying me too low. That attitude of people getting hired and then walking off the job a week later, or walking out without any notice. The standard things that we expect in that employer-employee relationship, the levels of respect were seen to be lower, and therefore then employers were quite shocked at employees that gave them very little respect. So there definitely needs to be work on both sides in terms of relationship building. And we do know that once people are well paid and they will work more loyally, they'll engage better and offer you a better employee if they're given a better scenario and don't feel like they could be laid off tomorrow. So it is a relationship building that needs to be there. It's interesting, the Canadian Chamber of Commerce just this week supports the basic income. So they're actually, for the very first time, recognizing that after the CERB was distributed. So they've just come out with an announcement yesterday, I saw it on Twitter, that they're coming out and supporting basic income guaranteed for people and that approach as well. So I think there is some recognition that under COVID-19, a lot of people couldn't afford to live on very, very low wages.
And I guess a further recognition as well, Jill, that poor people are also part of the economy. I mean, the more they make, the more they will.
The more they make, the more they will invest.
Yeah.
We also know that if people can't afford to live and they choose on some of the low wages part-time, they may choose not to work. We know that in some towns, and I don't know what the status is like in Owen Sound and Hanover, but I know for a fact that Port Elgin and Kincardine, they can't get enough people to work in McDonald's. They can't get enough people to work in the retail stores and the dollar stores because they're not making enough money. And therefore, there's services that people that have more money to spend want. You want your drive-throughs and your Starbucks and everything like that. But you've got to pay people a decent living. And I think there's also a misunderstanding as to who is getting paid that minimum wage. It's not just the university students or the students doing that. These are people trying to raise their families on minimum wage, and they're just not keeping up. 75 to 100%, 75% of their income is going to pay for their housing when they're only making that amount. And they're certainly not, I mean, that's the affordable housing range. They are not looking at purchasing their first house or even considering having enough savings to put a down payment on and start to build that credit. That I was discussing, that's a big issue between that attainable housing versus affordable housing.
Right.
And if I
Other
might,
committee members? Sorry, I missed someone.
Sarah, that's okay,
sorry.
Sarah. I was just hoping to share as well to the comment around the tension between the business owners and the minimum wage. I think it's important to note the discussion that takes place around spending in the different classes. So we know high class people or the higher socioeconomic status tend to invest their money. The middle class tend to invest in their homes, right? And the lower paid people, when they are paid well, reinvest back into the businesses. They are spending more on items in those local businesses. They're buying more of the things that they weren't able to afford before. So I think that circular notice of how the money gets invested back into those businesses is really important. And they will be more likely to spend in businesses that are taking care of them from an employment perspective than they will if they're not feeling taken care of from an employment perspective.
Definitely.
Councillor Desai, was that you I heard?
That was, thank you. I was going to bring up what the possible role of business sector would be at the poverty task force table. So thank you, Mr. Chair, for bringing that up. My second question is with regards to the meal programs at schools. It's an important part for many kids. I was at one of our local schools, and for many kids, the school meals are sometimes maybe their only proper, balanced, nutritious meal for the day. My question is, should municipalities be looking into funding any shortfalls for school programs? It's not within our jurisdiction, quite frankly, but at the same time, if you think about it, the kids who are there in school today are the adults of tomorrow. They're the future of not just our economy, but our society and our democracy, quite frankly. So should municipalities be taking a more active role in ensuring that a school doesn't have to cut back on its nutrition program, its meal program, simply because they couldn't fundraise a certain amount for the year?
In response to that, I would be definitely taking it up to AMO and advocating within the provincial government to increase the percentage per child that is currently coming down from the province. And we are certainly advocating as part of the national strategy for the federal government to actually say we will have a national food program in the schools across Canada. Japan and France and other countries actually have a hot meal program in all of their schools as part of the federal national funding. So I don't know where the money would come from. That's not my job, but it certainly is needed. And under COVID-19 right now, we've been working with Bev Gateman, who does the coordination for the Grey Bruce Ontario Nutrition Program. And they are significantly cut back this year under COVID. And so starting in September, we are coordinating with Bev and supporting her through our nonprofits connectivity program right now, which is really a food hub distribution. We're working with our food rescue program. We're getting surplus food from Zehrs, converting that into the grab and go bags that are currently allowed. So the two school boards have different policies as to what is currently allowed under COVID-19. But if we do return to normal, this is certainly a place that we need more food going into the meal programs. We know that a lot of the food towers, community gardens, our Food Security Action Group is working on a lot of the school community gardens. All of those are closed. We could not grow food this summer because the schools were closed. And so we lost a lot of opportunities for some of our community meal programs. We do have surplus food. We were able to get, like from Meaford Community Gardens, they had a surplus. They were able to provide to Bev to go into certain schools. But I would recommend that we look at the whole food system when it comes to feeding kids and look at what we are producing. Look at our surplus food right now. We have a lot of surplus food that we're taking from Zehrs. We're putting them into hot meal programs to serve households. And in some cases, we're able to take some of that surplus food into the school nutrition program. So we also have surplus non-perishable foods going into that. So the Salvation Army Owen Sound is coordinating that. And so we are piloting it at a couple of schools to see how much we can get from granola bars, things that are packaged right now, because that's all we can distribute. But there is that larger discussion that needs to happen. If we reach a point after COVID-19, how do we support and continue this surplus food donations that we have into the school systems equitably? And how do we do it systematically across all of Grey Bruce?
Thank you. Are there any other questions?
I do have a question on a different topic, if I may, Mr. Chair.
Absolutely.
Thank you very much. Moving away outside of the schools and moving on to the housing part of things. One of the stories in the We Are All Neighbors report is with regards to renovations. About the title of the story is Renoviction, really, and it's basically someone losing housing because they've asked for renovations to be done, it seems. I guess my question is there has to be a role for municipal and county and provincial even governments where we can make it more, we can incentivize the upkeep of these places. At a certain point, I understand that market forces will come into play, and that will, to a certain extent, dictate rent. But maybe we should be discussing, beyond development charges. We should maybe be discussing rebates for rental unit owners, where if they do make certain upgrades, we would give them a rebate as long as they commit to maintaining the rental, the affordable rental value of that unit for a certain number of years. Because I think similar to the housing market, which is quite frankly, it has boomed to a point where the average price of a Grey County home was $500,000 this year, which was a 25% jump compared to last year. We're seeing the same thing with rental units, where the prices continue to rise. And quite frankly, I don't have an answer for that, or a reason for why that's happening. I don't know if anyone else does. But should we, as a municipality, as a county, be looking at spending some of our revenue into incentivizing more people to offer market, or not market, but affordable rent. And the other aspect to that as well is, of course, our revenue comes from property taxes. So I think that also plays into the whole income redistribution or wealth redistribution of taking from a certain income point and moving that to a different income point. So I guess I'm just putting these out there because it's housing has been a big issue, and I think every meeting that we've had, housing has come up in one form or the other. And I think if we want to see, and this goes beyond Owen Sound and Hanover, housing and rental units are an issue in Markdale, Meaford, Durham, everywhere. So should we be looking at a strategy beyond just the we'll forgive development charges or we'll give you a development charges rebate? Should we be looking at a bigger picture approach to this and say we'll provide more than a significant rebate as long as it stays an affordable rental unit for X number of years?
I think,
I think that goes back to Anne Marie and her team in terms of the way in which they negotiate and engage with landlords. I think the other piece to that is I think we need the significant mental health component to go with that too, because we have heard from landlords that sometimes it's not worth constantly fixing up if we're dealing with challenges with people that have issues in the housing. I know that Anne-Marie has spoken to this in the past in terms of some of the really positive landlords she's worked with. Some of them are saying, they don't want to continue. And so then what is it? Is it the incentives to maintain the property? I think we're hearing more and more about the mental health aspects. Right now, Matt Shute, who is the director of CMHA Community Connections, is saying they've got a wait list of people trying to get into their programming, and they can't find apartments, and they have the dollars that could both support the rental unit to be maintained and so provide wraparound support for the individual to stay housed, and they simply can't find the numbers. So I think it is a full package that needs to go with the population that we work with to keep them housed.
right. So in response to Councillor Desai, I guess I would say it strikes me that there might be an approach that addresses both targeting Owen Sound and Hanover, because it strikes me that people in poverty tend to gravitate, at least Owen Sound and Hanover might have a greater proportional share of people with poverty because, of that concentration. They can get to that doctor, they can get to perhaps their job, they can get to cheaper food sources, that sort of thing, and programs and services. But the rebate thing is actually quite interesting because that might be a way of us addressing the poverty issues just generally, if we incentivize people generally. So I do think that the response needs to be targeted in those areas where we see higher concentrations, but as well recognizing that it's not just poverty is not just an issue in Hanover and Owen Sound, it's throughout the county. I see Anne Marie waving her hand.
Just a comment to the, incentive. We do have what's called a rent supplement program. And what that does is it does provide a rent supplement directly to the landlord for what a person can afford versus what the rent is. So if a person is on OW or let's say Ontario Disability, and their rent portion is $485 and the rent is $800, then it can pay that difference for that person to stay there. It is a very successful program. We do run it with provincial dollars. It could be supplemented by county dollars. It is certainly a way, but I can say it only works for a certain number of people because the housing has to be appropriate. So it has to be in good condition, and it has to be somewhere that that person has the supports. But yes, There is a program similar to what you're talking to, Councillor Desai. But I also think there is that option of possibly looking at some units that are not in the greatest of condition, and how could we incentivize landlords to improve those too. So there's probably two different scenarios within that thought process there.
This is very good stuff and very good discussion. I don't want to stifle discussion, but we do have one other presentation to be made, and we're supposed to finish at 11:30.
Can I just make
invite more comments? Sorry, just one second. Invite more comments. But I just want us to be conscious of time as well. Councillor Desai, go ahead.
Thank you. I'll just make it really quick. I think Anne-Marie hit on something quite important there. It's for people who are on certain programs that these further rental programs exist. I think these programs should maybe even exist for people who are working and who are in fact making a minimum wage and are still unable to afford housing. Because frankly, I feel that if we're unable to support those people who are working and are unable to afford their housing, we're incentivizing them going onto these provincial programs. And I don't know if that's the right message or a right thing that we should be doing. So I just want to make that quick comment. Thank you, Mr. Chair.
You're welcome. Anne-Marie, anything to say on that?
So the rent supplement programs that we do run through the county would, anyone making $30,000 and under would qualify. So someone who was working minimum wage would qualify for this program. We just need more of it.
Can I just add something?
Please.
I think another part of the policy analysis that would go behind any future program directions really has to understand the economics of being a landlord as well. I think Randy talked earlier about our intent to want to talk to the people that are running these buildings. I think it's important for for council to understand how the tax treatment of the rental income, the capital gains aspects of that, and in order to determine where the opportunities and the challenges are that the landlords face. I'm always concerned about what could be perceived as taking public money to support a private business. And we just want to go carefully in that direction.
Good point. All right, anyone else before we turn things over to Sarah? Wonderful. Sarah, you have the floor.
Thank you very much. Can everyone see my slides?
I can see your slides, and I remind the other committee members that the slides were also available online next to the agenda.
Which is wonderful. Thank you.
Yeah.
Because as Jill said, and in the interest of time, there'll be a number that I just slipped through quickly to get the kind of information. So I wanted to thank you for having me today. You are only the second group to hear this information outside of after the advisory committee for the Community Safety and Wellbeing Planning Group for the municipalities of Bruce and Grey counties, because we are coming to the end of our 14-month project to bring the plan to life for the two counties and those 16 participating municipalities. So many of you would be aware, and many of you have been at the table when we've had meetings, this work started in Grey and Bruce 18 months ago. When we started the discussion, we had the Ministry of the Solicitor General come present to us about the new legislation under the Police Services Act. And the goal of community safety and wellbeing planning is really to achieve communities where everyone is safe, has a sense of belonging and opportunities to participate, and where individuals and families can meet their needs for education, healthcare, food, housing, income, and social and cultural expression, with the goal of ultimately leading to a reduction in crime. So this is a crime prevention project, and it's crime prevention work. But as you heard Jill talk about, all of the different components of risk are interrelated. I'll talk a little bit more about that in a moment. So the Ontario Community Safety and Wellbeing Planning Framework has 4 areas of response for intervention, areas for action that we want to focus on. And really what we're looking at, as you can see, the rings get bigger and then smaller. we want to focus more on the social development and prevention aspects of the intervention so that we need to invest less in risk intervention and incident response. So historically, when we're talking about issues like mental health, like addiction, like housing, we're really looking, and crime specifically, we're really looking at incident response. And what we know and what the research tells us is that we really have to shift that focus to those upstream interventions where we're promoting and maintaining community safety and well-being, where groups are coming together like the Poverty Task Force and the Community Drug and Alcohol Strategy, Violence Prevention Grey Bruce, to really look at the upstream. Where do the risk factors start and where can we tackle them in a much more, not just effective, but cost-effective way? We know that the actions we take further upstream cost us less and have a more significant impact on our individual and family lives and on our communities from a health and safety perspective. So from a prevention perspective, we're talking about proactively reducing identified risks and implementing evidence-based situational measures. So some of this will look at how do we prevent the activities, the risks from actually coming to fruition. We want people to feel safe, be able to participate more in services, and be confident in their own abilities to take care of themselves or prevent harm from happening. When we look at risk intervention, this is where we're mitigating situations of elevated risk. And this is where multiple sectors would work together for people who are at risk to prevent situations from getting worse. So things like the situation table for acute response we have here in Grey Bruce is a collaborative of police services and various service providers where they would identify an individual or a family that is at high risk and seems to have more contact with services or police and might need more wraparound support. And then, of course, incident response is the one when we think about safety and well-being and crime. These are the critical and non-critical incident responses. So this is where we're looking at police, fire, emergency medical services, child welfare organizations potentially having to remove a child from their home, or someone being apprehended under the Mental Health Act and taken to hospital because they're at risk to themselves or others, or a student getting expelled from school, right? This is when the incident occurs. And what we really want to do through community safety and well-being planning is shift to well before that incident even happens and look at what can we be doing to assist and to support so that we don't end up in those situations, or our community residents don't end up in those situations. So our advisory committee, just quickly, you've got some slides here. We have a number of participants in this project from municipalities, the counties, our police services boards. We have First Nations participation. This slide has been updated. Actually, we had all 14 police services boards participate, whether they were there in person or had delegated to their local police service, detachment commander or chief of police. We have children and youth services and youth justice at the table. Education, all 3 boards of education and Georgian College were there. Lots of community and social services came to the table, of course, because these are the groups who are already doing the work in the community that is so important. Health and mental health were there, and several community committees and collaboratives who are already taking action in this realm. So we had 70 community partners at the table, including the municipalities and counties. It has been extremely diverse, and we've ensured that all of those organizations have come to the table and been able to give their input into this plan. So what did that look like? So the creation of this plan that we will be presenting to councils in the coming 6 to 8 weeks, almost 2,000 residents from across Grey and Bruce took part in the public consultation process that has informed this plan, and that has helped us identify the priorities for actions. Both counties and the 16 participating municipalities provided financial support to fund the project and to hire me as the coordinator to dedicate time to this very important work. Hundreds of hours of employee time was dedicated through phase 1 through the steering and advisory committee participation and consultation. Grey County assisted us in developing our website for the project, which you see here, and I welcome you to visit. We did have data analysis and epidemiology support as well to look at our survey, not just our survey analysis, but also our local data analysis that has informed those areas for action. And we were also supported through the Canadian Municipal Network on Crime Prevention, the Halton Region Community Safety and Wellbeing Collaborative, as they were one of the pilot groups for Ontario who did this planning a few years ago, and the Ontario Municipal Social Services Association, who pulled together a working group of coordinators for these plans across the province so that we could remain connected and continue to move this work forward as a group. So wanted to thank them as well. So this is what our timeline has really looked like. As I said, 18 months ago, we started the discussion, but then the work actually came together last September. So we had our project kickoff, and then we began looking at how would we map our assets across Bruce and Gray. We did community engagement, fulsome community engagement, as I said, with a survey, community survey, following our website launch February 1st of this year. And then we hit COVID. And we were very, very pleased as a collective, I will say, that our survey closed March 22nd, just 1 week after the majority of community services and organizations shut down because of the pandemic. So we were quite pleased to be able to get that survey under our belts and have the data to look at, because many communities were not as far along in this process as we were, and still at this point have not been able to reinitiate their community safety and wellbeing projects, whereas we are now releasing our plan, which is very exciting for us. So we spent the summer looking at that survey analysis and collecting our local data, really analyzing what are the different components under the 10 categories of risk that we have, and what does the local data tell us about this, so we could balance resident perceptions with what the data is telling us when we came to the decision for the areas for action. We then worked on plan creation and looking at performance measurement and how we would actually tackle and look at the outcomes of this project moving forward. And then, as I said, over the next 6 to 8 weeks, we're looking at plan adoption. So that's the lower tier, 16 lower tier councils approving this by resolution and entering this into their bylaws with the county support for endorsement. And then we will begin in phase 2 of the project in the new year, looking at action planning. How do we work with our community partners around this work? This just shows you a map of the governance structure, how this project came together. You can see we have champions. We had our huge multi-municipal and multi-sector advisory committee. And I will say at this point in time, we are the largest collaborative of municipalities in the province. We are unique in that we have the 2 counties and the 16 municipalities. We are not a region per se, like Halton is already a region where they're a collaborative already. Our 16 municipalities and 2 counties came together because we really wanted to do this work collectively, to come up with a regional plan that we would then be able to action with our partner organizations and committees who also cross the boundaries of our municipalities and our 2 counties. So our model really is designed to make sure that we have a mechanism through which emerging or known safety and wellbeing issues can be identified, prioritized, and addressed in collaboration with the community. So we are looking at how do we engage with our residents, with the committees that already exist, with their groups of residents who are already participating and informing the work. We want to make sure all of those voices are heard. We, as I said earlier, want to focus on social development and the preventative solutions to really try to shift that approach upstream. And we want to also look at the system level barriers and gaps in our human service system that can negatively impact people who are vulnerable and result in an increased demand on those downstream interventions, those emergency and crisis driven services. We know the calls for service for police have increased related to mental health concerns. And we know police are not the people who should be responding to those issues. And they know that, and they're asking for help. So we need to collaborate to really pull that together and move that upstream. We also want the model to convene those executive leaders from the organizations who have system planning accountability. Those are the ones who have resources and can look at planning collaboratively to really have an impact, right? We know we can't do this alone. We have to do this together, and we can have much more impact together. As Jill talked about, that collective impact approach, that's really what we're looking at in this project. We also there's a huge opportunity here for us to achieve greater coordination and collaboration between existing issue and planning tables, and to really help that organization and communication flow. And again, that collective planning. I've said for a number of years, it would be wonderful if in sectors or across Bruce and Gray, we had one plan. And I really think this community safety and wellbeing plan, because it focuses on the social determinants of health, gives us that focus. It allows us to show people where their organization, their committee, their work sits in the framework of safety and well-being for our communities. It will strengthen how the community can plan and deploy resources to address the priority issues. Again, it will create opportunities for us to align resources and efforts to get that collective impact and look at those priorities. It will help us anticipate issues and service gaps through enhanced data and knowledge sharing, and I'll speak quickly about that in a few minutes. And it will also ensure that we're ready to respond when emerging issues are identified. So at our last advisory committee meeting, I was really pleased to hear one of the municipal partners talk about the fact that this allows, it provides a framework and a table for where municipal local issues can be taken to help with resourcing and planning, to say, you know, we're putting our hands up and we have a concern. How do we tackle it? How do we go about this? And how do we do this as a collective, as a region, with support and with the knowledge of what's already happening across the communities? So I thought that was wonderful because that's exactly what this project is looking at. So this is really the meat and potatoes here, our priority areas of risk. And as I said earlier, these priority areas of risk were informed both by resident perceptions, but also by the local data and what we know, what our local data tells us is important and is concerning actually in our region. So originally we had said that the plan for the region would look at the top 3, but as Jill said earlier, and as we all know, you're sitting on this task force for a reason. These concerns are so intertwined that we decided the plan needed to highlight the top 5 because they were very, very close from a resident perception perspective. And we also know they're all intertwined very tightly and require action on all fronts. So our first, the priority risk area 1 is addiction and substance use. And the concerns in the area continue to be regular heavy drinking, which is higher than Ontario. And that we know that there's been several projects and interventions focused on the drinking alcohol use rates here. It's a serious public health issue in our region. We know that school student alcohol and cannabis use is increasing. And still emergency department visits show that over half of their visits are linked to alcohol. And now there has been a 2.5 to 3 times increase for opioid related visits. And we know that there is an opioid concern in our community. We also do know, though, that the concern is not necessarily reflected in some of our local police data for drug offenses because of the legalization of cannabis in October of 2018. So it's difficult to look at the trends at this point in time, but we are still seeing from those emergency department visits and from the health concerns in the community from the agencies that this is an increasing trend. We also are seeing that addiction and substance use is a cause of increasing hospitalization and death in the region. And what the community told us, of course, this ranked highest.
Sorry, Sarah, can I interrupt you?
Yes, yeah, absolutely.
Are you in this area? Are you creating a distinction between alcohol and addiction services versus mental health in general?
We are only from the perspective of what is the underlying concern, right? Not from how we necessarily take action in these areas. That may be linked and defined because we know mental health and addiction is a mental health concern, right? That is where it falls as a diagnosis, and it is a health concern. So how we tackle these concerns may be intertwined, but from a perspective of the Ontario framework, addiction and substance use is a category of concern separate and apart from mental health. But you'll see from the resident perceptions, there are similar perceptions around what the specific areas of concern are.
Right, I find this interesting because at the Board of Health meeting just a week or so ago, we heard that the research shows that there's a correlation between addiction and substance abuse issues and childhood trauma.
Absolutely. And that childhood trauma causes mental health concerns, right? Often addiction and substance use, Buck, is a symptom, right? It's a symptom of a mental health concern. This is the way, as Jill said earlier, this is the way people cope with their trauma and cope with the challenges they're experiencing from a mental health perspective, right? So that is the way that in mental health and addictions treatment, which is my background, that is the way we tend to look at it, right? That it's not the issue in and of itself, it's caused by other concerns, generally mental health concerns of long-standing nature.
Thank you.
You're welcome. So the community perceptions, it was ranked, addiction and substance use was ranked in the top three areas of importance by 58% of survey respondents. And you can see Bruce County versus Grey County there. But this is the key piece. When asked which areas were of particular concern in this category, illegal drug use, alcohol use, access to addiction services, as Jill talked about, of huge concern, and then prescription drug use was also noted. So looking at the local data alongside these resident perceptions will help drive our areas, our action planning in these areas as we enter phase 2 of the project in the new year. Several comments in the survey also mentioned concern about the availability of illegal drugs in their community, their perception of that, and the negative impact that it appears to have on crime rates, mental health, and employment. So again, all interrelated. When we look at priority risk area 2, mental health, again, no surprise here. And it does, as you can see, include conditions such as depression, anxiety, bipolar disorder, as well as trauma, suicide, access to services, coordination of services. So our indicators and areas for concern, self-rated mental health indicators show that while approximately 1/4 of Bruce and Grey residents rate their mental health as excellent or very good, approximately 20% experience a lot of stress and 15% report seeking help for mental health issues currently. More than 1 in 3 students from grade 7 to 12 says they're concerned with moderate to severe psychological distress, and 1/3 of those want to talk to somebody but still don't know where to turn. So there's still an opportunity there for the connectedness and access of services. As I said earlier, both EMS and police services in the region have seen increases in calls related to mental health concerns, and the 211 data also shows that calls for mental health concerns have increased. Self-harm emergency department visit rates have tripled among young females locally, which is comparable to the province, but still concerning. And Bruce and Grey males 25 to 44 years have higher hospitalizations and death by suicides than Ontario. So this is across Grey Bruce. And suicide is the leading cause of death for those 25 to 44-year-olds, which is higher than Ontario, and is the second leading cause of death for the 15 to 24-year-old age group, which is the same as Ontario. So when we look at community perceptions, 41% of survey respondents ranked mental health concerns in the top 3 areas of importance. And when asked which areas were of particular concern, they said the availability of mental health services and access to those services is still of concern. Mental health conditions such as depression and anxiety are of significant concern, that people are feeling this is more prevalent in the community. And the affordability of mental health services were noted. And as we dive into these perceptions as well, some of this has to do with being able to get transportation to services if they don't live in a center where there are services available. Several comments also identified the need for more mental health services for children, long wait times, and better crisis services being accessible. Priority risk area 3 was crime prevention, and this category includes, as you can see on the right-hand side, a variety of different crimes, actual crimes, so from animal cruelty to break and enter, to abuse of children, intimate partner violence, gang activity, homicide, human trafficking, threats, and assaults. And although it is difficult to get a clear perspective on crime statistics across Bruce Grey because of the 8 different partners that we have. So OPP has their own way of tracking their data, and then each individual police service, municipal police services, has their own data and statistics. We know that this review, looking at the data and how we compare the data so we can collate this information, will be of utmost importance as we move into action planning. But what we do know is that criminal court cases show that trends are increasing over time for most offenses. There's a 17% to 27% increase for most offenses between 2017 and 2019. And overall assault injuries are comparable to Ontario rates, except that Bruce and Grey rate of emergency department visits due to assault is higher than Ontario. So the police statistics related to assaults are similar. We have higher rate of emergency department visits for assault. And again, from a crime perspective, prevention perspective, the community perceptions, 44% of survey respondents ranked this in top 3. And when asked of particular areas of concern, they said break-in and enter, drug trafficking, and theft were followed by intimate partner or domestic violence and human trafficking. These are the resident perceptions. Several comments in the survey also mentioned concern about road safety issues, and we know this is an issue up the peninsula, certainly for Highway 6 and 10. And this is something that the Safer Communities Committee is working on as well. And also drug-related property crimes and violence, as well as there was lots of requests for more proactive and preventative policing. So more of that community policing perspective, where people know the police in their area and feel connected to them outside of a time when there's an incident.
Sarah, are the stats for human trafficking in Grey Bruce any higher than the provincial?
I can't speak specifically to that at this point in time. We are working on our indicator report, which will have some of that information. But we do know the statistics are lagging behind the awareness, right? Because we know it's an issue, and yet we still don't have perfect information around the prevalence of it because people are so worried about talking about it if they are actually experiencing it. So I can tell you from working in mental health and addictions, the number of people who were talking about it in counseling has been on the rise for the last several years. But certainly we know that the statistics may not be reflective of what's actually happening because it is still an underground concern, an underground issue as well.
Thank you.
You're welcome. So these were the two that we added in, priority risk area 4 and 5, again, because they're so prevalent. And Jill spoke a lot about this, so I won't go into too much detail on this. You do have the slides here, but priority risk area 4 is housing and homelessness. And Jill has talked a lot about that. So we know that we have more owned dwellings and far fewer rental dwellings compared to Ontario and Canada here in Grey Bruce. We do know some areas have more subsidized housing. So Owen Sound, Meaford, Kincardine, and Southgate are noted as having more subsidized housing. Over 15% of homeowners and almost 50% of renters in Bruce and Grey spend more than 30% of their income on shelter costs. So this is the situation that Jill talked about, where we're really concerned that these are people who are only 1 to 2 paychecks away from not being able to pay their mortgage or their rent, right? So this is that precarious living situation that people are encountering. And I will tell you, just some of those statistics have already been mentioned, but housing waitlists we know are increasing, as are calls to 211 for housing issues. This continues to be on the rise. Community perceptions. So when asked what areas were of particular concern, the affordability of housing and availability of housing and access were noted, of course, followed by the concern around homelessness. And several comments in the survey mentioned concern about the lack of affordable housing in various communities, the lack of variety. So again, that comment around smaller, more affordable homes, and the need for more education of tenants and landlords on rights, and the concern that many individuals or families stay in those unfit, unsafe housing conditions because there are no other options available to them. Then, of course, priority risk area 5, poverty and income. So Jill spoke quite a bit about this. I will tell you that, again, this includes ability to pay bills and meet basic needs, to enjoy life and participate in leisure activities, stress related to financial concerns, the availability of financial supports, and the access to financial supports. A key statistic here is that we know the median household incomes in our region are lower than Ontario and lowest in Owen Sound, Hanover, and the South Bruce Peninsula. And about 20% of children in the region live in poverty. This is the highest in Huron-Kinloss, Chatsworth, and then Owen Sound, Southgate, and Erin Elderslie.
Wow, say that again.
So overall, 20% of children in the region live in poverty based on the low income measure after tax, and that's the highest in Huron-Kinloss, where 30% live in poverty. Chatsworth has 28% of their children living in poverty, and Owen Sound, Southgate, and Erin Elderslie are all around 25% of children living in poverty.
20% of kids are living in poverty.
Yes. And so this is where it's actually, it's an interesting construct here, because we know that if we make more improvements upstream in healthy child development, we reduce a variety, all of these risk factors are reduced if we can promote healthy childhood development, including crime. Crime statistics go way down when you focus on healthy child development. And yet it's the perception of the residents in our community is that that is actually of lower concern than a variety of other pieces, right? So that's a key component of the community safety and wellbeing project is also to look at that community education, right? The understanding around the social determinants of health and how that impacts so many aspects of service delivery, of your life, of risk, and situations you could find yourself in, that we really have to focus well upstream before these kids are even conscious of being able to make decisions, right? We need to take care of those children and help them grow up in an environment where they feel well taken care of and have the information they need, right? So it's an interesting piece of education for the project as well when it comes to community perceptions.
Yes, amen.
And then, so the community perceptions then, of course, areas of particular concern from residents, the ability to pay bills and meet their basic needs, and their stress, of course, related to financial concern then, being able to access financial supports, and then their ability to enjoy life and participate in leisure activities, because that comes second to just trying to get through the day, right? And that actually is a huge component of wellness, feeling like you have the ability to enjoy your life and participate in activities that you find enjoyable, that connect you to your community. People who are struggling financially do not feel they have the capacity to be able to do that, especially if activities cost money, right? Several comments also mentioned concern about the lack of affordable housing in the region, quality, stable employment, as Jill talked about the precarious employment concern in this area. The challenges of seasonal work and the need for the living wage and or basic income plan, and that food insecurity piece as well, as Jill talked about. So this is where, as I said earlier, we really want to focus on the local solutions and the collective impact. And in response to these priority risk issues or areas, the advisory committee is going to work to consider how we identify an action table that already exists and partner with them. How we form an action table if there is a gap that is identified, how we go about resourcing that. We could plan for future action if it's a longer term planning process that's required. Looking at gathering more data and information, and this is a huge piece, as Jill talked about, really looking at that collective data analysis and collection, and how do we make sure we're comparing apples to apples and that we're collecting it on a regular basis to inform all of our decision making. That's a huge component of this planning process as well as we move forward. And then, as I said, providing information and education either about the issue to organizations or to the community at large, right? So this may be a piece where I've said, working with our police partners, resident perceptions may not be the same as the statistics we're seeing relative to crime. So how do we make sure that we're educating and bringing that more in alignment so that the residents are aware of what the realities are and what we're doing to tackle them? And we know that we're all working from the same playbook, right? So we all have the same information. So again, collective planning across sectors and between those collaborative committees will really need to occur in order to ensure that our responses and actions are system-based and are tied to our project outcomes that can then be evaluated. So making sure that we're really looking at those outcomes, not just the individual outcomes, say related to an individual or family, if we're looking at a risk intervention situation, but really evaluating the impact, as Jill said, looking at the impact, not just how many meals provided, but what's the impact then to the broader community of providing all of those meals, right? What did that mean for people's well-being and safety in the community? As I said earlier, the plan is to leverage the good work already being done across Bruce and Gray by enhancing that collaboration and coordination of the work being done to really partner with those groups and tie in the municipalities, right? Because this is a municipal plan. The municipalities are supporting this. And under the legislation, they're accountable for supporting and ensuring that this planning takes place. So that's another key piece of this, is it really pulls the municipalities together. And that's why I'm so proud of Bruce and Gray that 16 of the lower tier municipalities came together to do this. So our indicator report, I will touch on this just briefly. So as we dove into the local data, we realized we really wanted to create a foundation for future planning, because this is a long-term initiative. This is not a flash in the pan. We take action on something and then the project is done. Community safety and well-being planning is a long-term planning process because the impacts of those upstream interventions take years to see the fruition of that and to see the benefits of that and to see that return on investment. So we are asking municipalities and planning partners to come to the table and know You may not see the impacts necessarily in your next 4-year political cycle or your next 4-year strategic plan for your organization. It's a longer term investment, but we will see those benefits to the community over time. So we decided we would create this indicator report for the future planning processes as well. So some of that data I gave you for those top 5 categories, we're diving into that in our indicator report for all 10 of our areas of risk. And the other 5 areas of risk is to highlight community belonging and neighborhood environment, education and employment, emotional violence, bullying and harassment, healthy child development, and physical health. So it's a range of the social determinants of health, right? It encompasses all of the components of safety and well-being. And so we're creating this indicator report to go alongside the plan so that we have not just a description of how we go about identifying our priority areas of risk, so using those local data sources and playing that off against resident perceptions that we have collected. But we also want it to be an overview of safety and well-being in Bruce and Gray at a point in time for each of those priority risk areas. So we'll have baseline data, including the sources, and we'll also include the frequency by which those statistics are collected, so people know where to go if they want more information. We'll have a summary of what those community perceptions were from our current survey that took place in the spring. And we'll have an identification of the areas for action to be taken for improvement. And so this report will really facilitate outcome evaluation for community safety and well-being, using our locally available data and acting as a resource for the advisory committee and action tables. So from a sustainability perspective, discussions are underway across the 16 municipalities and the 2 counties for budget approvals for the coming year. And the current discussion for forming a 2021 budget for implementation involves continuing the shared funding model that was created for this phase 1 of the project, which would allow us to leverage a pool of funding that would be sufficient to continue the resourcing of this initiative and to move towards implementation. And the concern, of course, is that without that funding, which is a relatively small amount, I know budget's tight, but it is a relatively small amount for each municipality or county to commit, that brings together that collective impact. So that pooling of resources really allows us to do more as a region than each municipality would be able to do on their own if they were trying to enact this plan independently of anyone else. And so it will also allow for that streamlined approach and making sure we're not having a duplication of work between municipalities, so that we have one project moving forward for the region. And so the next steps, really, we'll be presenting to county councils over the next 2 weeks for endorsement, and then the plan will go to municipal councils for approval by resolution. We'll be posting the plan on county and municipal websites. We'll have that annual budget confirmation for sustainability of the project and look at the recruitment of the coordinator to drive this work forward. We'll then be identifying or creating those action tables with the support of the advisory and steering committees. We'll do an in-depth review of local data and further community engagement to support that action plan development. COVID did impact our ability to run community engagement sessions and to really dive in with residents around those specific areas of concern. And so we're going to be leveraging the work of those action tables and those connections that are already made, the people with lived experience of mental health and addiction issues, the people who are currently struggling with their housing and with poverty issues. There's lots of tables in the community that are already collecting that information and have those partners at the table, and we want to leverage that good work moving forward. And then, of course, implementation, monitoring, evaluation, and revision of the plan will occur, and that is mandated by the legislation, although there are no specifics around that just yet. But we will be presenting annual progress reports to the advisory committee, councils, and the ministry as this project continues. And there we are. That's it in a nutshell. 14 months of work in a nutshell. And I appreciate we're over time.
Yes, we are, but very, very important information to have. Committee members, any questions or comments? And then there was silence. So I think that this is such important work. I'm glad that we're getting this because it's hot off the press.
You're getting it hot off the press.
And the level of participation is very impressive.
It's significant. Mm-hmm.
Thank you for
And I would tell you the partners at the table, many of them have been extremely engaged and wanting to see how this pulls us all together, right? To have that collective voice, to share those messages, to really come together around planning, whether it's in the region or provincially, to say, these are our needs, here is what we're doing, and here's what we need to support moving forward.
right.
Mr.
Okay.
Chair, I will just let the committee or the task force know that there is a presentation coming up on the November 12th Committee of the Whole agenda with Sarah, and Barb will also be providing a staff report on that as well.
Yes, I know that Sarah's going to be offering a world tour, I think, of this, because I understand Hanover is scheduled for December 7th. So very good.
Yes. Yeah, we've been asked to present to a variety of local councils, the lower tier councils, as well as police services board. So yes, I'm doing a roadshow, but much of it by Zoom. So
Excellent. All right. Is there anything else? Any other questions, committee members? No, I'll go back to, where am I? Trying to find my agenda once again. Here we are. Is there any other business? Seeing none, it looks like our next meeting date is going to be November 16th, 2020. The focus is going to be, Madam CAO. You're on mute.
There. I have a list, which I don't have open.
Yeah. Is that the one on policing?
I can,
Thanks,
it's
Heather.
addiction and mental health.
Thank you.
Right. Thank you.
Yes.
Yeah. All right.
The police aren't joining us, I don't think, until January, which allows them time to review the reports they were waiting for.
Excellent. Very good. What a great meeting. Thank you so much to our guests, Jill and Sarah. This is, I feel privileged to sit on this group because honestly, and Randy as well, when we dig into this data, we really do get a much better understanding of what's going on in our community and what our role needs to be in response. So yeah, thank you again, and thank you to everyone. And I'm looking forward to even more as we move on. All right, folks. If there's nothing else, then do I need to call Madam Clerk for a motion to adjourn, or?
Yes, you do, sir.
Okay, can I have a mover, please, to adjourn? Okay, Mr. O'Leary, adjourn.
I'll second. Mr. Warden, second.
Seconded by Mr. Warden. Is there anyone opposed? Seeing none, we are adjourned. Thank you so much, folks. And I know we ran late, but this was a really, really good meeting. Great information.